One of the issues that was...
If I could just offer a further comment. This would allow a platform for us to continue the excellence that has been established by both institutions in their ability to attract and retain and develop a talented medical staff. It is becoming more and more difficult around the country to be able to recruit and retain certain subspecialties. This would give us a big advantage to do that, and so that patient that you mentioned would have a better shot at having a much better skilled, much better talented physician taking care of them than perhaps if we didn't do something like this.
And one of the issues that was rumored to hold up this deal was different views on abortion. How much of an issue was that, and how will that be addressed?
Well, I'll take that. You okay with that? We spent a lot of time understanding the ethical and religious directives and the responsibilities and the culture and the vision of Catholic healthcare. Our board spent, actually, we had several meetings on that topic alone, as well as our management team. And I think when we look at those ethical and religious directives, we were surprised at how compliant we are with them to begin with in the outset. And to my knowledge, there was really minimal controversy, if that goes to your question, about that topic. There was a lot of time spent on related issues around that, and I think that we were able to come up with a workable solution to that. But around that specific issue, we did not really dwell on that issue of abortion very, very long.
Can you talk a little bit more about the solution? I guess more along the lines of reproductive services like birth control, tubal ligation, services like that.
Well, I can't recall all the specifics of that, Melissa, but I know that we've worked it out so that physicians who are on our medical staff that will do those things will be doing it not as part of the OSF Northern Region. They'll be doing it in space that's private, not as a part of the organization, not with any kind of assets or property that belong by the organization. They'll be doing it on their own time.
I guess can you maybe, this will be my last question, explain that a little more, because I do know that, well, we all know that OSF is more of the religious hospital, I guess you can say, and Rockford Health System has no religious affiliation. So with the affiliation, well, pretty much, I guess I'm trying to think as a patient, if I wanted to, would I just continue to go to Rockford Health Systems if I didn't want to deal with any of the religious aspect, or like how will that part merge? Or
First of all, Rockford Health System is a religious institution also. We're just not of one faith. We have chaplains, we have student chaplains, we have internship programs, and we accommodate a multitude of faiths. And secondly, there would be no reason to do that, and if there was a reason to do that, the patient's physician would advise that patient on where best to go for that care.
Can you talk a little bit more about the regulatory process? I know you have to go to the Health Facilities Planning Board for a certificate of exemption. What's that process like? And then do you have to submit separate paperwork to the feds? Or tell us a little bit more about how that works.
Well, the first filing would be for the Hart-Scott-Rodino federal review. The way that chronology works is once we file the paperwork, they have 30 days to respond. And that can be, yeah, go ahead and do it, or send us more information. The high likelihood is it will require more information to be submitted. Then we keep on submitting information until they tell us that's enough, or you've answered our questions. And I believe that starts yet another 30-day clock. At the end of that point in time, they have to say either yay or nay. And beyond that, there are appeals processes. If they say no, if they say yay, then we move on. The state certificate of exemption through the Illinois Health Facilities Planning Board, as Gary said earlier, that paperwork will go in about the same time as the Hart-Scott-Rodino filing, and that would position us to be on the May 10th agenda to be heard by the Illinois Health Facilities Planning Board.
No other questions? You're really quiet today? Any other comments, questions, things we can clarify? We are very excited about going forward with this and greatly appreciate the level of interest in the room today and certainly look forward to continue working with the community as this endeavor develops. Thanks to all of you for being here. Thanks, Jennifer.